Good afternoon, well actually still morning. Good morning to all. I'm Major General Jeff Holmes, Adjutant General of Tennessee, and we are here to actually recognize a lot of hard work and a lot of effort. There's a saying, it's when a project is hard or a difficult mission, you're building an airplane in flight. I think everybody's heard that remark. Well, I've never built an airplane in flight, but I would suspect that this would be the closest thing to it. Coming from a architectural perspective, I realize the linear or very linear approach to projects, and I think anybody in that profession can understand. I know Governor Lee understands that very well. Everything is very linear, and I think this project represents starting a number of actions simultaneously to culminate on the event today. So many different agencies, so many different fingers, so many different teams. I consider it a team approach. We've been very fortunate to have all the players on this project. I know it started out, Governor, I think it was weeks ago, months ago, seems like a decade ago. General Whittle had a conference call with us on a Sunday afternoon about this very aggressive plan to build out alternative care sites, driven by the Corps of Engineers. And we heard that brief. We were pretty amazed at the aggressiveness of it, basically putting in place what you see here today in less than a month. And the governor's guidance was we need to execute this because of the criticality of the mission. And I think we're here to see all those great accomplishments. You know, victory is sweetened by the difficulty of the mission and really the consequential risk of failing at that mission. That makes this mission all the more sweeter. And I think there's a lot of people, thousands of people, hundreds of people. Some of those are here today that were behind the scenes that make this effort happen. From the local officials, state officials, Army Corps of Engineers obviously are both of our great districts. These events and things like this. Now this sets the bar pretty high. Bob, Colonel Miller, Colonel Abishaw sets it pretty hard of what we've accomplished in the past. But we've got two great district offices with the Corps. We've been able to endure a lot of floods, things of that nature. It's a teamwork effort. We didn't exchange business cards when this thing started. We had an ongoing great relationship. So this is just a day to kind of sit back, pull our head out of the task, and recognize the extreme significance of what you've done for this community and what you've done for this state. So congratulations to all. There's still work to be done. So now I'll introduce the 50th governor of the great state of Tennessee, Governor Bill Lee.
Thank you, Joe Holmes. Thank you for so many who are here that partnered together to make this happen. We are in a historic time in our country, and we certainly are in this state. And we have come together as communities, as members of the private sector, as nonprofits, community leaders, the Corps, the National Guard, the City of Memphis, the County of Shelby, the University of Tennessee. Multiple partners come together to make this happen right here. And what this is a representation of how a community can come together in the midst of a crisis and integrate, cooperate, coordinate, and execute. That's exactly what's happened. That's what this building, in the form that it now stands, represents an incredible amount of partnership and coordination. And I just want to thank those. Mayor Strickland's here, Mayor Harris is here, members of the General Assembly, multiple are here, local leaders. If I start naming and listing, I'll never get through it. But as you can see, there's a great amount of cooperation that had to happen. And I came to this facility probably 3 weeks ago. Started talking about this facility months ago when the COVID-19 crisis broke in our state and our need to be prepared. The amount of work that's been done right here in the last 30 days is incredible. And as a person who used to be in the construction business, I can say it's incredible what's happened up there. But it's impressive. But here's why it's important. This is one of the few sites built in America with the Corps, that were coordinated with the Corps in response to the COVID-19 crisis that actually create a long-term asset for a community. So many of the sites across the country were built with the understanding that they would be taken down within just a few months. This one was done with foresight and a longer-term lease that allows for an asset that this region, this city, this county, this region, and the state of Tennessee will have for some time into the future. We hope that we never have to use this building for COVID-19 overflow. But we also know that this building could be used for other things in the future, and we're proud of the fact that so many came together to make this happen. So I want to give a couple of shout outs specifically to the teams that worked here on this site. There were 65 companies engaged in making sure that this facility was done. 400 beds built there for overflow capacity for COVID-19 or for future use for a crisis that we may face in this community. It's an 18-month lease, and as I said, it's not a temporary situation. It is one that Memphis and Shelby County and Tennessee should be proud of, and I certainly am proud to have it. ACOM was the primary contractor working here. Yates. I want to thank Doug McGowan, Dr. Walker, Dr. Williams, Terry Stewart, and the staff that are the directors for this facility. Memphis Light, Gas, and Water was an important partner in making sure that all that had to be done in such a short period of time came together and was done. There are many others that we should and I could thank, but I just want to make sure that the folks that were on the ground here making sure this happened and a transition to operational team are thanked. So I'm very proud of what's happening here. I'm very proud of what the Corps has done in partnership with the federal government. You know, this whole crisis that we have walked through as a state and as a community and as a nation has been something that most of us have never experienced the likes of in our entire life. I'm incredibly proud of the way this state and this city and this community have responded and have worked together. There's a reason that our state has the outcomes that we have had through this crisis. There's a reason that we can protect the health and safety of our citizens and reboot an economy and get people back to work at the same time. There's a reason that we're a state that can do that, and it's because of the great effort and the great work that's been done in Tennessee. And it starts at the federal level, and our federal partners, including the U.S. Army Corps of Engineers, have been incredible partners. It flows through to the state level, where we have made effort to create an environment where local communities can navigate their way through this crisis in a way that's best for their citizens, but it's executed at the local level. And as I see leaders here locally, mayors and others who have made sure that this community has a strategy that's fit for the uniqueness of this community, it makes me very proud. I'm proud of the way Tennessee's responded. We have a long way to go. We have much to navigate through. We have much unknown ahead of us. But based on how we have navigated through as a community and as a state so far, I feel very confident for the days ahead. So thank you for everyone coming out here, to those that were involved, but also those to support. I want to let General Whittle give a little more detail about, with the U.S. Army Corps of Engineers, a little more detail about this particular facility. General Whittle.
Thank you. I'm Bob Whittle. I'm with the U.S. Army Corps of Engineers, and let me begin by saying that our hearts go out to the victims of COVID-19 in this crisis. But this facility is certainly a great sign of the future of the United States of America and the state of Tennessee, and what we can accomplish under great leadership, and the fact that we're going to make it through this and continue to be the great nation that we are. So it was 10 weeks ago that I did have that conference call with Governor Lee, as well as with Major General Jeff Holmes and Patrick Sheehan from the Tennessee Emergency Management Agency, and our two district commanders here, Colonel Zach Miller from the Memphis District of the Corps of Engineers, and Lieutenant Colonel Sonny Abichal from the Nashville District of the Corps of Engineers. And on that call, we laid out the possibility of building these alternate care sites. And of course, the great state of Tennessee took full advantage of that capability. We're very proud to be partnering with all of you. I'm just going to name a couple other people that have been key players. Dr. Lisa Piercy from the Tennessee Department of Health. We have Mayor Jim Strickland, of course, from Memphis, and Mayor Lee Harris, and Dr. James Walker from the CEO of the Medical Task Force here. One of the absolute critical things about this facility is we're able to work with the future customers of this facility, the people that would run this facility, right from the very beginning, so that it could be built to the specifications that were required. So just a couple of facts about the facility that I'd like to share. So we built 37 of these across the country with the U.S. Army Corps of Engineers, 37. This is the only one that was a commercial facility that we have converted. And the commercial appeal building, of course, has a lot of great history here in Memphis, Tennessee. There's still a rail spur on the other side of the building where ink and paper was brought into this building. There's still a portion of that printing press inside the building itself. And so it's one of the great things about the history of Memphis, Tennessee. Now it's one of the great things in the future as we combat this crisis. So there is a significantly large scope of work. Demolition, over 1 million pounds, much more than that of material that was brought out. An exterior ambulance bay that was built, exterior liquid oxygen tanks that are in place, the conversion of 4 floors with HVAC, electrical, fire suppression. There are ICU-like pods inside there with vacuum, med gas, and oxygen. So if a patient takes a turn for the worse, they can be intubated here before they're brought out. And of course, the location of this is near all the great medical facilities of Memphis. So the location of this building was absolutely critical. And it is great that Memphis has it on hand. I know they've got it for many months ahead. Should they need it, of course, hopefully, ideally, we won't need it. And I would like to go ahead and present Governor Lee with a plaque to express our appreciation. And so this plaque reads Tennessee Alternate Care Site Memphis, constructed April 15th to May 15th, 2020. Think about how much work was done in less than 1 month to serve the people of Memphis and surrounding areas in response to the COVID-19 pandemic. Funded under a mission assignment from the Federal Emergency Management Agency, built at the request of the state of Tennessee, the city of Memphis, and Shelby County. Design and contract administration by Memphis District, U.S. Army Corps of Engineers. Medical equipment installed by Tennessee National Guard. Medical mission coordinated by the University of Tennessee Health Services Center, Tennessee Department of Health, Tennessee Emergency Management Agency, and Shelby County Health Department. And constructed by the contractors at ACOM Technical Services Incorporated. Governor, thank you. Thank you.
Okay, thanks to all. So at this point, I think we'll transition to a few questions and answers. So I'll open up the floor for any questions.
Governor, what are the big challenges that the state faces right now as it relates to the pandemic?
What are the big challenges the state faces right now?
Yeah.
It is the challenge of continuing to uphold the safety and health of every Tennessean. while we reboot our economy and get people back to work and off of the unemployment rolls and back into their jobs, but do so in a way that's safe, that protects the public, that protects those workers. That's the greatest challenge we have before us.
Are we better or worse off than you thought at this point we would be?
Well, we certainly are encouraged with where we are. We are very fortunate to be in the spot that we're in. We've tragically had a great deal of loss of life in this state, but we also have, we've had very encouraging numbers, particularly in the last several weeks, that have put us in a spot where we can begin to put people back to work. So I'm very encouraged with where we are in the midst of this pandemic.
Governor, what is the state doing to assist people who work in factories who may not speak English? What's the state doing to help alert those non-English?
Could you say that one more time for you?
Sorry, Governor.
I'm sorry.
I'm trying to follow the rules.
Yeah.
What is the state doing for folks who may be working in factories who don't speak English as their first language? How is the state helping assist, alerting them about what to do, how to get tested, that kind of thing?
So we just printed our Reopen Tennessee Safely Tennessee Pledge booklet in Spanish. So workers who speak Spanish can read all about that, the guidance there, and we're looking to translate that into other languages as well. So we're making an effort to make sure that every Tennessean understands how it is that they can be safe. We also have had specific outreach in our testing. You mentioned testing. We have specific outreach to communities who have less access traditionally to testing. We're testing in housing development agencies. We have a specific focus on the Hispanic community in our state and making sure that we reach that community as well. We are, as you know, fully testing all of our prisoners in the Department of Correction. We've completed that. We're in the process of testing every nursing home resident and staff member in Tennessee. That should be primarily completed by the end of May. So there's a real effort to target testing so that every Tennessean has access to it.
Governor, can you talk to us about the state budget, what you're thinking, where you are?
So her question was about the state budget. It is going to be significantly challenged, as every state budget in America will be. This has been the most rapid decline in the economy of our nation since its founding. And Tennessee will have those same economic challenges that many states face. We are very fortunate in that we have had years of fiscal responsibility in managing a budget. The legislature and previous leadership have set Tennessee up well for financial crisis, but nonetheless, it will be a great challenge. There will be a lot of work to do when the legislative session begins again on June 1st. The primary work of that session will be crafting a budget to meet what we know will be a significant challenge in the year ahead.
Do you know how often revenue is at this point?
There are only projections about revenue now every month. As those revenue numbers come out more, we'll have a greater understanding of what the actual numbers are, but we know it will be significant.
Governor,
Yes.
what would you say to people that are concerned about experiencing unemployment, the processing and the delays that people are experiencing?
Her question was about the delays and the difficulty in obtaining unemployment, and it has been an incredible challenge. As you know, the first week of this pandemic, our unemployment office received 25 times the amount of calls. We've received and processed about 3.5 million customer calls in the last several weeks, 450,000 claims. We are through the vast majority of those, but what I would say to people that have experienced that is it's deeply regretful that they've experienced it. It's bad enough to lose your job, but then to not be able to get unemployment as rapidly as we would like everyone to is a real challenge for us. We have employed in excess of 300 additional folks in the Department of Labor to process unemployment claims. We have made significant improvement on that. We are well down the road. We were one of the first 10 states in the country to actually process the pandemic insurance benefit. And I'm proud of that, but nonetheless, it's been a great challenge. But we're very encouraged with where we are today, the call times, the number of claims that have been processed, and we think we're going to be in a really good spot in just a few years.
Governor, can you talk about how the cost is being shared on this facility?
This facility is being cost shared with the state and with the federal government, and there's still uncertainty about. The only reason there's uncertainty about that is because there's been a request by many states to ask for an additional portion of the funding be federally. So that's not all finalized now, but it is a cost share between the federal government and the state. Anybody who hasn't asked a question, got one?
Last question.
Governor, I know you've donated thousands of masks here to Shelby County. You've assisted with some of the investigations of the nursing facilities. Any other assistance you expect the state will provide in addition to that directly to Shelby County to help with these efforts?
Well, every county is very important if we're going to attack COVID statewide. Certainly, this is a major community and a major population center. I just left a remote testing facility that the Corps of Engineers is partnering with the local housing authority to implement in an effort to reach as many folks in as many communities. Part of our goal is to not only have people come to remote testing facilities, but us go to them. That's why we were in this remote facility today in their community, working together as partners. We will continue to partner with Shelby County and with Memphis for as long as I'm in office. We're going to be partners, but with regard to COVID-19, we'll continue as long as there's a virus in our midst, and that's going to be for some time. So this partnership here, testing partnership, we look forward to partnering in the days ahead. And let me just say this too. I'm on calls with governors every week. We have a very unusual situation in the state of Tennessee. The partnerships between the local officials here and the state, partnerships between municipal mayors, county mayors, the way that we have executed our reopening plans have been incredibly well coordinated. We've worked together, and I can tell you it doesn't go that way everywhere. So I'm proud of the partnership that we have, the state with this community. So thank you all
everyone.
for being here very much.